Okay, let's go over an endometriosis case study. This particular lady was in her early 30s and she had a very prolonged history of debilitating menstrual periods. Now, she had received at some point a diagnosis of endometriosis, and basically her symptoms were very heavy periods, extremely painful periods to the point of having to lay down, take medications, sometimes take time off work, and the discharge of a lot of clots. It's a very important symptom from a Chinese medicine standpoint, the discharge of clots. Now, in addition to this, she was dealing with a lot of digestive problems. Now, I see this quite a lot when it comes to endometriosis because remember, that endometrial lining is growing outside the uterus. That means it can be growing around the intestines, can be disrupting digestion, and in her particular case, she had a prolonged history of bowel problems, a lot of loose stools, a lot of abdominal bloating, and then there was this other symptom that was a part of it where she would get this very strong, deep ache in the muscles of her legs. Both legs, this is free from any kind of injury. And this is significant because when we have something like endometriosis, which is indicative of something called blood stasis in Chinese medicine, that blood stasis or this ability to create a pain like that or a growth can impact the body on the whole. So when I'm seeing this endometriosis and I'm seeing this pain in the legs, there's a possible relation between the two, or it's very possible that I'm going to be able to hit both when treating one of them, which of course is the most ideal type of situation. In this particular case, I used a very common approach. I used one formula that combines about 8 different herbs that are designed to kind of break up this stagnant blood in the abdomen and actually improve circulation to the abdominal organs. And I added a combination of herbs to that, Pinellia, Poria, and ripe tangerine rind. This particular combination is very nice to help in removing any mucoid deposits. It's got very, very positive effects on the microbiome, and it tends to aid digestion and really aid the microbiome quite a bit. So I added that together, these two combinations together. So now let's look at our first follow-up. That was about 2 weeks in. The daily abdominal discomfort she was getting from all this digestive issue was reported to be about 50 to 70% better, which is just fantastic. The bloating was virtually gone, and that leg pain, that deep muscular leg pain, was like 80% better, which is just phenomenal. You know, it's a great thing to get rid of that when you're really aiming at something like endometriosis. Now, there hadn't been a period yet, so there's no report card on that. So let's go to our 4-week follow-up. So at the 4-week follow-up, that daily abdominal pain, the bloating, some of the loose stools, doing drastically better. The leg pain was basically gone. She did have a period. Now, day 1, interestingly enough, there was no pain. Now, day 2, there was still some decent amount of pain. She said about 50% of what it was. So that's better, but it's definitely not completely fixed. We definitely need to keep working there. She also mentioned that there was an increase in the discharge of clots. This is very, very important because if we're trying to remove this stagnant blood from the body, it's common with that first period or two when starting herbs that you'll actually see an increase in discharge, which is actually a good sign. So at the 2-month mark, she reported that her period did not include many clots, so we didn't see that at the 2-month mark, but the pain was drastically better, no need to lie down in the bed, and no need to take any pain medication. Now, we kept going because this is a prolonged condition, so we still need to keep doing the herbs here. Now, at the 3-month mark, there's basically no pain. The digestion and other symptoms were continuing to do well, at which point we tapered off the herbs. That's a very successful example of treating endometriosis with just basic combinations of herbs. In this particular case, using some that's really tailored directly more towards the endometriosis or this blood stasis pattern, as I mentioned, and some that was really aimed at promoting intestinal and digestive health because it was such a significant part of the problem.